Good morning, everybody. I'm delighted to be virtually here with you all today across 5 countries to provide you with some food for thought in terms of what is the definition of obesity and why should it matter. I'm Jacqueline Bowman-Busato and I'm the EASO policy lead, and I'm also coordinating the expert secretariat for the MEP interest group on obesity and health system resilience. Obesity has been defined as a disease since 1948 by the World Health Organization. Yes, 1948. The latest wording is that overweight and obesity are defined as abnormal or excessive fat accumulation that may impair health. Very precise, scientifically accurate. Furthermore, the European Commission built on the WHO definition in 2021, so almost a year ago to the day, saying pre-obesity, overweight, and obesity are medical conditions marked by an abnormal and/or excessive accumulation of body fat that presents a risk to health. Obesity is a chronic relapsing disease, which in turn acts as a gateway to a range of other non-communicable diseases such as diabetes, cardiovascular diseases, and cancer. That was a major milestone in terms of really clarifying the definition of obesity, which is precise, scientifically accurate, and in such a form that allows policymakers to actually make meaningful policy interventions and frameworks. So let's take a moment to breathe and digest what has just been said. According to the international norms, both within the WHO as well as within the European Commission, the definition of obesity is not about eat less, move more. It's not about BMI. This has been classified as a metabolic disease since 1948. And as I'll go on to feed more into your brains in one moment, it has also now been very clearly categorized as a non-communicable disease, an NCD, certainly within the European Union context. What does that actually mean for us? And why should it even matter? There is a difference between legally recognizing a particular medical condition as a disease, and also a difference between once that disease has been recognized as such legally, or certainly within a policy framework, that it is then placed within a recognized treatment and management framework, commonly known as the NCD framework. Categorization of obesity as an NCD and squarely placing it within that framework has tremendous ramifications, not least because all research provides and generates evidence for policy making along the life course and along the policy making cycle. This is key. When we have a clear framework from a policy perspective and treatment and management and guidelines to work with, it actually means that policy interventions, research priorities, implementation research, measurement, surveillance, all of these different things suddenly flow from something which is precise, which is scientifically accurate, and which has been shown to show better health outcomes. I can't emphasize that enough. However, it's one thing to have a legal basis and scientific evidence on paper. It's a very different story from a policy implementation perspective to see how that framework can actually come to life. And this is actually our challenge, and this is why we're gathered across 5 countries and later on with over 100 plus stakeholders to actually work out what could be going into these national plans. For as we all know, and that's partly why we're gathered in our various countries to work on this together, there is political will to develop national plans that go beyond primary prevention and actually address the onset of obesity as an NCD, as well as the disease progression along the life course. However, the famous phrase, much more remains to be done. We don't need to reinvent a wheel in this case. There is an NCD framework. There is lots of clinical practice, best practice examples, both from the world of obesity onset and disease progression, treatment and management, and also from the over 230 medical complications of obesity. It's time for us to have a joined up approach. It's time for us to implement obesity as an NCD within the framework. And with that, I end my food for thought reflections, and I wish you all an extremely fruitful set of discussions and collaboration today and moving forwards. Thank you.